Hello, friend. Welcome back to our channel Quality Group. Friend, our topic is Media Field Test Failure Investigation, a breach in sterility. It's a part B. Media Field Test Failure Investigation. Sterile manufacturing is a critical process that requires meticulous attention to detail and adhere to strict aseptic technique. One of the key measures to ensure the success of sterile manufacturing process is the media fill, also known as aseptic process simulation, that is APS. Media fill exercise should be conducted during the initial setup of an aseptic filling line and periodically thereafter. Manufacturer can identify potential issues, train operators, and implement corrective actions to prevent contamination and ensure product safety by conducting media fill exercises. In case where a media fill test result in failure, a comprehensive investigation become imperative, and there are some effective strategies for investigating media fill failures in sterile manufacturing, as well as clear example to know that when media fill failures are present. A media fill failures investigation is a crucial mandatory process in sterile pharmaceutical manufacturing to pinpoint the root cause of contamination in a production process. The investigation involves meticulously documenting all activity during the media fill, correlating them with the instances of contamination, and examining potential sources like personal error, environmental issues, and equipment malfunctions. A thorough investigation helps determine if the failure has an assignable cause, it required corrective action and retest, or a non-assignable cause requiring revalidation of the entire process. Acceptance criteria for media fill. The acceptance criteria for media fill are defined in a regulatory guideline as per guidance for industry sterile drug product produced by aseptic processing current good manufacturing practices published in September 2004. Recommended criteria for assessing state of aseptic line control are as follows: when filling fewer than 5000 unit, no contamination unit should be detected. One contaminated unit is considered the cause for revalidation following an investigation. When filling from 5000 to 10,000 units, one contaminated unit should result in an investigation, including consideration of a repeat media fill. Two contaminated units are considered cause for revalidation following investigation. When filling more than 10,000 units, one contaminated unit should result in an investigation. Two contaminated units are considered cause for revalidation following investigation. UGMP Annexure 1, Manufacture of Sterile Medicinal Product, Section 9.46 mentions that the target should be zero growth. Any contaminated unit should result in a failed process simulation, and the following action should occur: an investigation to determine the most probable root cause, determination and implementation of appropriate corrective measures. A sufficient number of successful consecutive repeat media fills, normally a minimum of 3, should be conducted in order to demonstrate that the process has been returned to a state of control. A prompt review of all appropriate record relating to aseptic production since the last successful APS. The outcome of the review should include a risk assessment of potential sterile breaches in batches manufactured since the last successful process simulation. All other batches not released to the market should be included in the scope of investigation. Any decision regarding their release status should consider the investigation outcome. All products that have been manufactured on a line subsequent to a process simulation failure should be quarantine under a successful resolution of the process simulation failures has occurred. Production should resume only after completion of successful revalidation. Investigating media field failures. Conducting an investigation into media field failures is a complex process that requires substantial effort, expertise, and experience. The objective is to accurately pinpoint the root cause of the failures and identify the most relevant corrective and preventive actions. When initiating the investigation, it is crucial to identify the precise moment when the failure occurred. This can be achieved by meticulously monitoring the entire sequences of events during the media fill process and documenting any intervention activities and individual involved, establishing connections between activity and contamination. To effectively investigate isolated instances of contaminated unit, it is important to tabulate all activity against the time they were performed. This includes meticulously recording the following: start time of filling assembly, filling operation, interventions, shift changes, the addition of rubber stoppers for vials, environmental monitoring, breakdown, intervention and action taken during the media fill process. Investigating media fill failures. Once the activity and the time point have been documented, it is crucial to establish a connection between these activity and any instances of contamination or failures that may have occurred. By analyzing the record, manufacturer can identify potential factors that can contribute to the failures. Furthermore, it is imperative to meticulously record every intervention and action taken during the media fill process. While not mandated by regulatory requirement, video recording can also provide valuable insight into personal practices that may have a detrimental impact on the aseptic process. Factor to consider regarding investigation. A more comprehensive investigation becomes necessary if a clear cause is not evident from the initial review. This involves examining these factors: environmental condition during the filling operation, air velocity, high efficiency particulate air filter integrity, that is HAPA, cleaning and sanitization issues, trends in environmental monitoring results, machine maintenance, system abnormality, proper assembling by a trained operator. It is important to revisit the most recent area and equipment requalification, focusing on critical factors such as HEPA filter integrity, air velocity, and particle count. Any deviation or anomalies in these factors can potentially contribute to media fill failures. Step for media fill failure investigation: identify the contamination in timing. Observe the failure. Note which units are contaminated and the extent to the failure. Trace the entire process. Document all activity from start to finish, including assembly, intervention, and filling. Correlate activity with failures. Match the timing of failures with specific activity to identify potential correlations. Examine potential sources of contamination. Personnel. Review operator practices, training record, and any unusual interventions. Environmental factors. Check air quality, HEPA filter integrity, and cleaning sanitization record. Equipment. Investigate machine maintenance, assembling processes, and integrity of seal or connections. Determine the assignable cause. Assign an assignable cause if a specific activity or issue is clearly identified as a source of contamination. Implement corrective and preventive action, that is CAPA. Develop and implement CAPA to address the identified root cause. Reperform the media fill. Conduct another media fill to ensure the CAPA were effective. Handle non-assignable causes. Assign a non-assignable cause If no specific root cause can be identified, revalidate the entire process, consider the process a new system, and perform 3 consecutive successful media fill to demonstrate consistency and reliability. Examples of possible reason for media fill failures: when sterilizing the filtration skid, a connection or some part of the skid may not be sterilized and was not identified or evaluated during qualification. Aseptic connection is done in a grade C or grade B environment instead of grade A due to a lack of procedure or operator awareness. Leakage from filling needle during filling operation that result in the repeated intervention of filling needles adjustment and cleaning of a spilled product under grade A. Addition of a new item in autoclave load not part of validated load pattern. Addition of a new connection, new attachment like a dip tube, an inert gas purging tube in sterilizing filtration skid which was not part of a validated system. Sterilized vessels are not maintained under positive pressure throughout the sterile filling operation, creating a scope of ingress or non-sterile air in sterilized vessel. Validated sterilization parameters are not incorporated in standard operating procedures, creating a possibility of using a non-validated sterilization cycle. The inner surface of a sterile holding vessel has dent, scratches, crack, and rough surface which can support microbial proliferation. 7 measures to be taken to prevent media fill failures. Section 9.32 of Annexure 1 states that the aseptic process simulation should not be considered as the primary means to validate the aseptic process or aspect of the aseptic process. The effectiveness of the aseptic process should be determined through process design, adherence to the pharmaceutical quality system, and process control training and evaluation of monitoring data. The measure to be considered as a part of routine operation for sterility assurance in day-to-day operation as well as during media fill are described in these 7 steps. Step 1. Well-defined procedure for aseptic operation. Step 2. Operator training. Step 3. Validation versus routine operation. Step 4. Inspection of sterile holding vessel and equipment assembly. The condition of the gasket in the sterile holding vessel is a crucial factor that can contribute to potential failures. The inspection should include checking the integrity of connection, clamps, seals, and view glasses within the sterile holding vessel, filling machine, and product transfer line. A rupture, damaged gasket can lead to media fill failure. Step 5. Cleaning of inner surfaces and hidden contaminants. A thorough inspection of the vessel's interior is essential to ensure no residue, glue, tape, other contaminant could create hiding spot for microorganisms during the SIP process. Step 6. Validating wrapping and assembly of filling equipment. Step 7. Addressing challenges in complex manufacturing system. This includes ensuring robust sterilization, validating SIP processes, conducting water trial, and performing comprehensive leak tests for the entire system. Attention should be given to the placement of sensor, temperature validation, and smoke study to confirm the system integrity. Skipping essential steps such as water trials or conducting leak tests after intervention can lead to unexpected issues during media fill. Thank you, thanks a lot, and keep watching our channel Quality Guru. Like, comment, and subscribe more and more.